Welcome to NurseEmerge, where we enlighten and empower nurses and nursing students to excel in their chosen specialties. Join us as we illuminate the vast world of nursing, providing mentorship and guidance to foster a community of future healthcare leaders. Let's dive in.
Good morning, good afternoon, good evening from every corner of the world you can be hearing us from. NurseEmerge is here again, and we are doing something really unique today. I am Nurse Taiwo Precious, the founder of NurseEmerge. We'll be investigating into the critical care nursing spectrum. It's an aspect in nursing that deals with care of critically ill patients, especially those that have undergone invasive surgeries, those that have terminal illnesses and injuries. Though I'm not the one doing the dissection. We have a specialist here all the way from the United Kingdom who happens to be the founder of National Drug Dosage Calculation Competition for Nurses, NDDCCN. Thank you for honoring our invitation, sir. We are so grateful for this opportunity. You'll be answering some valuable questions to provide valuable insight into this spectrum. Stay tuned.
Yeah, hello everyone. My name is David Ogunlabi. I'm also called David the Nurse. I'm a critical care nurse. I trained as a critical care nurse in Nigeria, but I'm presently practicing as an ICU nurse in the United Kingdom. So I'll be answering a few interview questions, and I want you to follow closely as we embark on this journey together. Thank you for watching. Yeah.
The first question, could you share your personal journey into critical care?
Yeah.
What drove your decision to specialize in this?
All right, so I'll be very quick about that. My decision to my journey into critical care nursing started a few years ago, precisely in 2014. So before then, I was working with a construction company in Lagos State, and I was working as a site nurse in that construction company. So we did more of the occupational health nursing there, attending to workers and the staff, meeting their health needs, giving health education and health prevention and all that. So I decided to specialize in occupational health nursing. I went to UCH, School of Occupational Health Nursing, to specialize. It was a 1-year course. So after that, I applied for a job in UCH, and after the 1 month of orientation, they released postings, and I was posted to ICU. So that was what made me to go to the ICU. I never had it in mind. I never planned about it at all. So then getting to the ICU, I loved the atmosphere. I loved it. I began to develop passion for it. And so a few years later, an opportunity opened where UCH wanted to sponsor interested people, for the ICU course in Abuja, and I applied. So I went to specialize in the course, and that has been the journey. And till now, I'm still very passionate about intensive care nursing. Thank you.
Okay. Second question.
Yeah.
What are the primary responsibilities you undertake as a critical care nurse, and how much do they contribute to patient care and safety during procedures?
Okay, so as a critical care nurse, one of the major skills, when I was in ICU school, we used to say that critical care nurses are nurses with the third eye. So what that means is that our assessment skill must be very keen. Assessment is very important. Ability to pick what is going wrong with the patient, ability to pick, signs in your parameters, ability to pick things. So, and that is why we have all the normal values at our fingertips. So when you are checking the results of your patient, blood results, ABG results, and whatever, or you are taking vital signs of your patient, looking at the monitor, you should be able to pick that something is going wrong with this patient and that promptness to intervene is what saves life. Okay, so I will just major on that assessment, your assessment skill as a critical care nurse in patient care is very important, because if you fail to pick those signs, patients may die, within, it doesn't take time at all. Okay, so that's a major one that I feel that is a major skill for a critical care nurse, and it has a major impact on the general outcome of the patients in the ICU. Thank you.
What education training patterns are essential for aspiring critical care nurses and those interested in pursuing this specialty?
Okay, so about the educational background to pursuing intensive care nursing, I will first of all say that, of course, you must be a registered nurse. That's a general requirement. And to specialize in the course, from my experience, I will advise that people should just expose themselves to the ICU environment even before going for the course. It's a personal advice from me. If you are planning to specialize in the ICU, just go and work in the ICU first. Expose yourself to the environment, feel the vibes in that environment, learn for some time in that environment, get used to the instruments, the gadgets, get used to the slogans and all that we do in the ICU. Now, if you have garnered that, then you can go to specialize, and it will be very easy for you, and depends on the part of the country you are in. I know of Nigeria because I've been in Nigeria for some time, and I know of UK. So in Nigeria, you go to specialize. There are post-basic schools, even though they are working on upgrading it to postgraduate studies in critical care. So you can go to the school and specialize, learn about it, and so I think that's a major one, to specialize in critical care. But coming to the United Kingdom, there's a pathway. Okay, so when you are working in the ICU, we have the ICU foundation course that you have to go for. After that, you go for the proper ITU course in the university, and then so there you'll be awarded postgraduate certificate in ICU, and the journey goes on and on and on, depending on where you want to reach. Okay, so that is the major thing you have to do. Thank you.
What challenges do critical care nurses typically encounter, and how do you navigate them? Conversely, what aspects of your role do you find most challenging?
Wow. So the major challenge in ICU is very busy. So stress. ICU it's a very busy environment. It's very, very busy. Sometimes you will literally not sit down all through, especially when you are nursing a level 3 patients in the ICU, ventilated, sedated, on inotropic supports, on vasopressors, and all that. So there's a lot you have to do, run your ABGs, sometimes every hour, sometimes every 4 hours, patient on ventilators, changing the settings, checking your ABGs and all that. So there's a lot of stress, and then that is one aspect, that's the technical aspect of the stress. Then communication with the patient's family and relatives, some relatives can be very difficult, and it's not their fault. It's because when you have sick people in the hospital and you don't even know, maybe they will live or die, the tension is also much on them. Okay, so it can be a very tense environment. But what we do in the ICU is that because we know the tense nature of the work, we make it very interesting for each other, especially among the team in the ICU, among nurses. We laugh, we joke, we smile. We just want to relieve the tension. And that is one of the things I love in the ICU. We are not always very serious people like that, because the work itself is already serious. So we just lighten the burden and laugh over things, smile, and make a joke out of things to make it relieving for us. Then another part of that question says, what is the most rewarding? Now, for me, the most rewarding aspect is to see my patients, come out well. Okay, to see my patients come out well, to see your intervention work out. When you discover a problem and you try to fix it, and you see that this thing is really working out. You see a patient, for instance, struggling to breathe on ventilator, or the ABGs are not good, and you make some adjustments in the parameters in the ventilator, and you check it the next hour, and you discover that, wow, the PO2 has picked up, the PCO2 is coming down, everything is normalizing. Or you check your lactate is high, you give some bolus of Atmans or fluid, and you check later and the lactate is fine, you see. So it's really rewarding to see that you are giving intervention and things are really working. Thank you.
For individuals considering a career in practical care nursing, what advice or insight would you offer to help them prepare for success in this field?
So if you're aspiring to pursue a career in critical care, I want to congratulate you. You are welcome. The first thing is that you should prepare your mind that it will not be easy. So the mind preparation is very important, so that when you begin to face some challenges here and there, you will not be discouraged. So prepare your mind that you are coming in to do a serious work, and it's profitable, it's worthy, it's a worthy cause. You've been able to help patients recover and go through the recovery process in a very good way. So that is the first advice. Prepare your mind. Okay. And number 2 is that be teachable, be ready to learn. Be very ready, be open to learn, because there is a lot to learn in the ICU. In fact, if you have been working in ICU for years, there is still more for you to learn, and nobody is an island, so you have to be open and you have to learn. And another thing is that whatever you are not sure about, that is a personal slogan that I use. If you are not sure, ask. So the ICU environment must be the hierarchy curve must be flattened. Okay, where nobody is tensed, everybody should be psychologically safe to express themselves. When you are in doubt, you should be free to ask questions. Okay, so, and lastly, just like I said initially, that you have to be ready to work, put in the labor, put in the work, and learn, read. So you have to do a lot of personal reading by yourself. So most times what I do when I finish nursing a patient and I get to pick up my laptop, browse and read about conditions of the patients, equip yourself with knowledge. It is very important. Your patient will ask you questions. Your relatives will ask you questions. What is happening? Why is this value like this? You should be able to answer them. Okay, so, and it's a challenging environment, and you should not see that challenge as a discouragement. You should take it up as a challenge and face it and overcome it. So I wish you good luck.
Question 6. Could you share a notable patient outcome or experience that exemplifies the impact of critical care nursing?
Wow, that's a good question. So there are quite a number of such scenarios that have happened. Okay, so now there's a particular one I want to talk about in the UK. Okay, by the way, I want to say this. When I came from Nigeria to the UK, I had can I call it? It's not a culture shock, but a shock, maybe ICU shock or professional shock or something. I discovered that patients were not dying as frequently as I expected here in the UK, because back in Nigeria, we lost patients almost every day. And so I discovered that there are a lot of factors involved in that. I won't want to go into that. Okay. So, but in the ITU, there was a patient I remember very well, was rushed to the ICU. The patient had 2 episodes of cardiac arrest on the ward. So they rushed the patient to the ITU, and the patient suffered another cardiac arrest with us. So I'm just telling you this because the patient was very, very bad. There was really no hope for that patient. So we started putting things together. We came together, rallied around the medical team, the nursing team, and put the patient on anostropic support. Patient was ventilated and passed in CVC, passing arterial line, all those stuff we do in the ITU. Gave the patient some blood products, and so after that day, the following day, I was not at work. Then the day after, I came back and I saw this patient. The patient had been extubated already and was just put on a CPAP mask, that's the non-invasive ventilation. And the patient was already coming up and doing very well. Wow. I was so proud of myself and the entire team. Every one of us were so proud of each other because we knew this patient's condition when he came in, and we could see with our own eyes that this patient that we did so much for is really cooperating and is really improving. And the family of the patient were very grateful because of our help in doing that. So there are quite a number of such things that is very, very rewarding and will make you feel, wow, what I'm doing is really worth it. I'm not just wasting my efforts in this job I'm doing. I'm not just working to get salary, but that fulfillment that comes from you intervening and then seeing a better outcome from the patient. I think that is really a superb experience. Thank you.
How do you stay informed about emerging trends and advancements in critical care nursing practice? And are there specific resources and professional organizations you find particularly important?
Okay, so how I stay informed? Yeah, that's a good question because you have to keep abreast with information and trends in practice. Things are changing every day. So one of the ways in the UK, okay, if you are in Nigeria, you need to do so much by yourself. And I know that Nigeria is also improving, and I believe they are putting a lot of things in place to help people follow trends and get themselves informed about things going on in their different fields of practice. So while I was in Nigeria, personally, I did a lot of work by my own self, go online and browse stuff and read personal reading. But if you get to an environment where things are really working, there are structures in place that will help you to be informed. Okay, for instance, we have mandatory training that we do, and you have to attain 100% in that. So whether you like it or not, you just have to keep updating your knowledge in that area. Okay, because there are consequences for that. In my place of work, if you don't attain 100%, you may not get a pay rise or stuff like that. So that is a motivation on its own for you to keep learning. Then, of course, on your own, you have a lot to do. You have to be self-driven. If you want to be exceptional, you have to be self-driven. Okay, so what other things I do is that there are organizations like British Association of Critical Care Nurses. So I'm a member of British Association of Critical Care Nurses. So you have access to journals, so to know what is happening in the critical care nursing trends and all that. Then I joined another. I subscribed for another journal. So this journal is it's critical care medicine, and there are a lot of updates I on my email from time to time. They discuss very interesting stuff, sepsis biomarkers. I read one recently where they were talking about ventilator-associated brain injury. Okay, it's a current trend that research is still going on about it. So I get updates from there and I read up from time to time. Okay, so there are other. Then we also do seminars for British Association of Critical Care Nurses. They organize seminars sometimes every 2 months where you can attend. Symposium also. I attended a symposium last year, Drager Symposium. Okay, where you also know what the current things happening, and then go online, go on Google, search and know things. Keep yourself informed. So those are the few ones I can remember for now. Thank you.
Okay. Can you provide insight into the collaborative efforts within the team and how critical care nurses contribute to optimal patient outcomes?
Yeah, that's a beautiful question. And it's one of the things I love about ICU. You see, when you work in the ICU, you will come to understand that you have to be collaborative by fire, by force. If you don't collaborate, if you don't work together as a team, patient will suffer because they are the receiving end. They will suffer for it. Okay, so the ICU environment is, I think that the collaboration there, the collaborative effort there is top notch for me, with my own experience. Okay, so because you have a lot of people in the team, the nurses are there, the doctors, the dietitians, the physiotherapists, the speech and language therapists. We all come together and we just want to make this whole thing work. So the flow of communication among the team is very, very important. And I love it here in the UK where we make information very clear. You are free to call anybody at any time to clarify. Okay, are we starting TPN for these patients? What time are we starting it? Okay, where's the documentation? If anybody forgets to do anything, you can always remind them and say, this is what we are doing. And even, most times after they have documented, they won't just leave and just say, I've documented, let me go. They will still come to you, to the nurse, and say, oh, David, these patients have written a new prescription, this and that. So the flow of communication, I just love such an environment in which flow of communication is very okay. And for the role of the critical care nurse is very key, because we are the executors of every action plan, every plan that has been written. We are the ones to carry them out. Okay, patients, twerk the patients, you are the one to twerk patients and take out the catheter. If they say we discontinue this medication, you are the one to stop giving the medication. If they say that let's extubate this patient, you are the one to extubate patients. Okay, and then commence this patient on this and that. Let the patient start TPN at so time. So we are the executors. If you don't do it, the plan will just be hanging. So the critical nurses are very key and very important. And that sense of importance makes you enjoy your job. You don't want to be in a place where you are not important or you don't feel needed. All right. So we are very important. Nobody can do anything without the critical care nurses in the ICU. So thank you.
Okay. What career progression opportunities and pathways are available for critical care nurses seeking to advance their careers or explore specialized areas within the field?
Yeah, I think there are a lot of opportunities for people to explore depending on what you really want. Within the hospital or acute care environment, there are different things you can actually pursue depending on your passion. If you work in the ICU, some people have worked in the ICU for years, they just love that bedside where they take care of the patients. Of course, you can always follow that pathway and continue to care for your patients. And we also have the research. You can also carry out research if you're a person that is interested in research as a critical care nurse. You can also delve into that. Even as you practice as ICU nurse, you can go to present papers in different seminars out there, do your paper presentation, which is very okay. Then career pathway, I think I said it at some point in one of the interview questions, that it depends on where you practice. So in the UK, we have a specific pathway in which you will move. We have the step 1 competency, step 2 competency, step 3 competencies. Okay, so if you are new in the ICU, you first of all go through your step 1 competency, where there are a lot of, the system by system. So respiratory system, there are a lot of procedures there you have to get yourself exposed to: cardiovascular system, respiratory system, renal system, and all that. So that is related to the ICU. So you get all those ones signed off so that we know that you have developed competencies in those areas. So after that, then you can go for you need that competencies to be signed off before you can go for the ITU course. Okay, so and when you are finished with the ITU, I think you first of all do the ICU foundation course, then you do the major ICU course in the university. After that, you can apply to be promoted from band 5 to band 6. Okay, so when you get to band 6, then you do another competency step 2, and then so that's how it goes, and you progress that way. Okay, and there are other opportunities to also explore if you want to diversify, but that is a major pathway created for ICU here in the UK. I believe in other clients they have their own peculiar ways by which they can navigate that to the top of their career. Thank you. Yeah.
For critical care, considering factors such as experience, location, in addition to certifications.
Okay, it's an interesting question. So for international, what they call educational, internationally educated nurses, relocating from Nigeria to the United Kingdom. So when I came, because I had about 7 years experience in the ITU in Nigeria, I was already certified because I specialize in Nigeria, so I had the ICU certificate, and so I expected that when I come here, I should be paid more than another person and all that, but that doesn't really work here, because everybody will still have to come to start as a band 5. Okay, so but what I've discovered here is that your years of experience and what your certificates are not totally a waste, because of course you have the knowledge within you, and that will help you to move at a faster pace than people who do not have such before. Okay, but what I want to say is that the certificates you are bringing from Nigeria, they don't really pay so much attention to it. In fact, they prefer your years of experience. They prefer the experience you have had in the ICU to you presenting certificates for them. So they esteem experience in this place more than just certifications. And of course, if you're able to prove yourself, they are considering you for a role. Even if you get here within 1 year and you apply for maybe as band 6 nurse and all that, if they interview you and you prove yourself that you are fit for the job, you get it. Okay, so that is it. So to answer that question, it depends on what you are able to give the value you are able to offer. And after they have examined you, they feel that you really worth this position and this money or salary, and they will give it to you. Okay, so that is it. So experience is very important. Certifications are very important, and depending on the vacancies open for that. Thank you.
So, the last question.
Okay.
Lastly, what aspects of your role as a critical care nurse do you find most fulfilling, and what motivates you to continue making a difference in this field?
Okay, the aspect of my role that makes me most fulfilling is the fact that I love teaching, and I don't like teaching abstracts. I love the fact that when I'm teaching you out of what I have seen, I have handled, I have experienced. Okay, so as I work in the ICU, I also teach. Okay, I have a platform. I have a platform where I teach. I teach the knowledge I have acquired over time. Okay, and that is very fulfilling for me because I don't want the knowledge to stop with me. I want to transfer. I love transferring knowledge, and I've seen that work again and again because I get feedback from people, and that has really encouraged me to keep doing it, to keep learning, to keep engaging my patients more, because there's a lot to gain to get when you practice. So bedside nursing for me, I don't know why people don't like bedside. Some people don't like bedside nursing. Even if you will eventually end up in the university to teach, I think we should spend some years in the bedside, because that is where the real work is. That is where the experience really is. And the way nursing is such that you cannot just read a book and say you want to teach people. The people you are teaching, the knowledge will be most valuable in patient care, and patient care is practical. Patient care is just not what you read in. In fact, sometimes what you read in books, when you get to the bedside, you see that it's not practicable. Okay, so I love the bedside because I get a first-hand experience and information, and even if I read anything, I'm able to combine that and get a balance out of it. Then another fulfilling thing is that in critical care that I love is autonomy. We have autonomy in the ICU. If I check the blood result of a patient, I don't need somebody to write instruction for me to do anything. I know what to do. Okay, I check potassium is low, magnesium is low. I know what to do. This patient blood pressure is not cooperating, it's fluctuating. I know what to do. So that autonomy to intervene, to do something without waiting for somebody to instruct you for everything, I think it's really fulfilling for me. Okay, so sometimes we would have done a lot of things and the doctor would just come and just tell him, oh, I've done this, I've done this. Oh, thank you. And then the patient is already fine. I love that. Thank you very much for listening. I believe it's been a wonderful time. I want to appreciate the NurseEmerge. Thank you so much for what you are doing. Thank you for having me. I hope to do business with you again and again. God bless you. Bye.
Thank you so much, sir, for this eye-opening section with you as regards critical care nursing spectrum. We are so grateful for having you here. NurseEmerge as a whole, we are grateful. We are so grateful. We don't know how to appreciate you. Thank you so much, sir, for honoring our invitation. We'd like to call you again and again. I believe that we've picked one or two from this. I believe we have more insight as regards critical care nursing spectrum. Thank you so much for joining. Okay, if you have any question, please try to drop the question in the comment section. I know our speaker will be ready to answer all the questions. Kindly drop your question in the comment section. Anywhere you just find this video, even though it's a flyer, just drop the question that you have as regards this spectrum. And stay tuned. we are bringing more to your way. As regards nursing, please do well to research more on diverse nursing specialty. There is more to nursing than this. Please try to always research more on nursing specialties. Thank you so much. See you next time. Stay tuned, please, and make sure that you subscribe and you on the notification bell. Thank you so much. All right, take care, everybody.
Thank you for watching NurseEmerge. Remember to subscribe and hit the notification bell so you'll never miss an episode. Together, let's empower the nursing community to reach new heights. Stay inspired and keep pushing the boundaries of nursing excellence. See you next time.